Hello and welcome to the Gustavo Franco podcast, where we explore the multifaceted world of healthcare. I'm your host, Gustavo Franco, a passionate healthcare student and an aspiring physician. Our mission is to better understand the U.S. healthcare system while studying both its flaws and strengths, as well as comparing it to other healthcare systems around the globe. Not only do we examine the policies and regulations behind healthcare, but we also take a closer look at the experiences of patients and doctors within the system. We aim to provide listeners with a deeper understanding of how healthcare truly operates. We share stories of individuals navigating the U.S. healthcare system, as well as present engaging interviews with professionals offering their experiences and expertise to help us understand the inner workings of healthcare. We believe that an informed public is the key to creating a more effective healthcare system, and we dedicate ourselves to this mission, providing insight and analysis on the ever-changing landscape of the U.S. healthcare system. Join us every month as we embark on a journey of studying healthcare together. Please note that the opinions expressed on this podcast are ours and of our guests and do not constitute any professional advice. While we strive to be as accurate as possible, we acknowledge that there are often many viewpoints on a topic, and our research may not be exhaustive. Therefore, we encourage listeners to engage with the subject matter and conduct their own research and confirm any information before making any decisions. Thank you for listening and joining us on this healthcare exploration. Welcome to this month's episode of the Gustavo Franco podcast, where we delve into a critical issue that affects every 9 in 10 adults in the U.S., health literacy. Being health literate is more than just understanding medical jargon. It's about empowering everyone to make informed decisions about their own health and well-being. In today's episode, we'll not only uncover the layers of health literacy, but we'll also explore how understanding it can play a pivotal role in addressing the epidemic of health illiteracy that we face in the U.S. Health literacy is a super complex topic, and that's why I think it deserves its own episode. Consider this. How would you define someone as health literate? Is it just knowing that eating greens is healthier than eating French fries? Or does it require understanding the intricate mechanisms of how a super widely prescribed drug like atorvastatin works? While most statin users themselves may not know and comprehend the drug's mechanism, it doesn't automatically label them as health illiterate. So this episode aims to shed light on the intricacies of health literacy, a spectrum that defies a straightforward cutoff. To illustrate this, let's turn to Socrates' paradox, a concept from the 4th century BCE. Imagine a heap of sand, say 100,000 grains. As you remove grains, one by one, the heap diminishes and it becomes smaller until you have only one grain left. But when does it stop being a heap? At 100,000 grains, it's 100% a heap, right? At 1 grain, it's not. The challenge really lies in defining the exact transition point. When does it go from being a heap to not being a heap? Much like this paradox, health literacy is a continuum. While it's easy to classify, let's say, a 1-week-old baby as health illiterate and a seasoned doctor as health literate, most of us fall somewhere in between, defying easy classification. Even the government finds measuring health literacy difficult, and that's because of its multifaceted nature. Our goal in this episode is to unravel the present and applicable definition of health literacy. We'll talk about its evolution through the years, we'll explore strategies for measurement, and we'll discuss tangible ways to enhance it. We'll also talk about how individuals, just like yourself listening, will be at the core of improving health literacy in the U.S. So stay tuned to learn more and help the lives of those around you. Okay, so let's jump right into the episode. If you've ever tried to wrap your head around the term health literacy, you're not alone. Defining it is a little bit like trying to catch smoke in your hands. It's elusive and super impactful. So before we delve more into this, let's talk a little bit more about health literacy and really peel back all of its layers. But be warned, this is kind of a history class. We're going to talk about a bunch of different decades, and we'll talk about how health literacy and healthcare evolved together. Health literacy, as we know it today, didn't always occupy the forefront of public health discussions. In fact, the recognition of health literacy's importance and its impacts on individuals' well-being was a super gradual process. During the early 20th century, healthcare communication primarily targeted medical professionals and experts. Conversations between doctors and patients were super complex, often leaving people feeling distant from their own health decisions. With medical progress came more complex health info, and that just became a never-ending cycle that was worse and worse, and people couldn't understand what was going on. Everyday folks faced a maze of prescriptions, forms, and treatment plans, and making sense of all this information became super tough, especially for those with less education or poor English skills. And it wasn't until the later part of the 20th century that health literacy finally started to gain some attention in the US. Researchers and healthcare practitioners began to realize that patients who struggled to understand health information were more likely to experience adverse health outcomes. This realization sparked discussions about the need for clearer communication between healthcare providers and patients. Still, the concept of health literacy wasn't granted a formal existence until the 1970s. Isn't that crazy? And in 1974, it finally appeared, labeled as Health Education Meeting Minimal Standards for All School Grade Levels. But don't be misled by this early definition. The true understanding of health literacy was still at its infancy. The term health literacy remained relatively obscure, lacking a standardized definition or an effort to address the issue. So, efforts to improve health literacy were largely localized at the time, with some healthcare organizations and community groups taking it upon themselves to create a more accessible system. There wasn't much awareness about the impact of low health literacy yet, and there weren't any big plans to solve it in the works. So, health literacy significance was still a diamond in the rough, waiting to be polished and brought to the forefront of public health discourse. It wasn't until the 90s that a more comprehensive understanding of health literacy began to take shape. The term health literacy became ingrained in American vocabulary, and more studies were done to assess the issue. The turn of the millennium finally brought in the Healthy People 2010 initiative, a pivotal moment in the realm of public health. Established in 2000, this initiative finally aimed to shape the nation's health objectives for the next decade. It was here that health literacy finally found its platform, a nationwide definition and a way to measure it. So, let's talk about the Healthy People Initiative and how it came to define, measure, and tackle health literacy. Picture this. It's the year 1980, and a nationwide movement is gaining momentum. The Center for Disease Control and Prevention, also known as the CDC, steps onto the stage with a visionary concept, the Healthy People Initiative. But what exactly is it, and why did it emerge? The Healthy People Initiative is run by the U.S. Department of Health and Human Services, HHS, and their Office of Disease Prevention and Health Promotion, called the ODPHP. It came about as a robust effort to set comprehensive health objectives for the entire nation. Its mission, to improve the health of all Americans and create a roadmap for healthier lives. This initiative was more than a fleeting moment. It was a catalyst for change, a catalyst to rally communities, healthcare professionals, and policymakers towards a common goal. But how did the Healthy People Initiative work its magic? Every decade, the CDC set forth a new set of national health objectives, outlining clear targets and priorities. These objectives touched upon various aspects of health, ranging from disease prevention and wellness promotion to healthcare access and health equity. So, to break it down, the Healthy People Initiative aimed to, first, identify nationwide health improvement priorities. 2. Heighten public awareness and comprehension of determinants, diseases, disabilities, and pathways to progress. 3. Provide measurable goals and objectives that resonate on national, state, and local levels. 4. inspire cross-sector engagement, spurring policies and practices bolstered by the finest evidence and knowledge. 5. Identify pivotal research, evaluation, and data collection needs. So, by offering a framework for public health efforts, the Healthy People Initiative rallied diverse stakeholders to join forces, fostering a collaborative spirit that extended across multiple communities, states, and the entire nation. It was a remarkable endeavor that aimed to steer the whole country towards better health and well-being. Now, here's the intriguing part. The Healthy People Initiative reviews an updated plan every 10 years. This allows, of course, for adaptation, growth, and a renewed focus on evolving health challenges. With each cycle, new insights are gained, priorities are adjusted, and a fresher perspective is injected into the fabric of public health. But where does health literacy come into play? Well, it wasn't until the Healthy People 2010 initiative, which was published in the year 2000, that health literacy took its rightful place in the spotlight. In the vast sea of health objectives, the issue of health literacy emerged as a defining concern, earning its formal recognition and acknowledgement within this ambitious initiative. Now, here's where things get intriguing. The definition of health literacy that found its home within Healthy People 2010 was a result of the pioneering work of Scott Ratson and Ruth Parker. They eliminated health literacy as the degree to which individuals possess the ability to obtain, process, and understand fundamental health information and services necessary for making appropriate health decisions. It's like having the key to unlock the mysteries of your health journey. But it wasn't just about individuals. The Healthy People 2010 also recognized that bridging health literacy gaps is pivotal in reducing health disparities. This recognition spurred the inclusion of the objective to elevate the health literacy of those with limited or marginal literacy skills. A key insight emerged. The healthcare system itself needed transformation to align with the overarching goals of Healthy People 2010, aiming to enhance both the quality and length of healthy lives while dismantling all these health disparities. They had to make it easier for people with limited abilities to understand their own health conditions and how they could achieve well-being. This profound understanding led to the inclusion of a robust objective within Healthy People 2010's framework. So objective number one, improve the health literacy of persons with inadequate or marginal literacy skills. Think of it as extending a helping hand to those who might find the healthcare information a maze and a bit more intricate. But it doesn't stop there. Healthy People 2010 envisioned a transformation not just in individuals, but in the whole architecture of healthcare. It recognized that achieving its overarching goals, boosting quality, increasing years of healthy living, and banishing health disparities would really need a change in the healthcare system itself. So, the Healthy People 2010 used data from the National Assessment of Health Literacy, the Department of Education, and the National Center for Education Statistics to categorize people as having proficient or below basic health literacy. And what they found was truly monumental because groups of below basic health literacy had health disparities of 100% or more. Now let's fast forward to the evolution of Healthy People, making the dawn of the new decade. Healthy People 2020. The definition of health literacy stood its ground. It continued to emphasize the capacity to understand and act upon health information for well-informed decisions. But this time, the narrative expanded beyond to encompass the broader societal and organizational contexts. Imagine health literacy as a vibrant ecosystem where individuals' abilities converge with the complexity of health messages. Pesh, Orlow, and Wolf pointed out that health literacy isn't just about patients. It's a phenomenon intertwined with the entire healthcare system. Parker and Rotson echoed the sentiment, acknowledging that sectors like education, health, healthcare, businesses, and social services all play a pivotal role in fostering a health-literate society. So, Healthy People 2020 painted a vivid picture, showing us the importance of organizations in enhancing patients' grasp of health information. It spotlighted the significance of patient-provider communication and the integration of quality digital tools. But it's important to remember that Healthy People 2020 still maintained the same definition of health literacy as the one from Healthy People 2010, which, for you to remember, is the degree to which individuals possess the ability to obtain, process, and understand fundamental health information and services necessary for making appropriate health decisions. So now let's dive into how this actually came to change and how we have the definition that we have this day and how health literacy changed with Healthy People 2030. Imagine a story of discovery where ideas merged and evolved, and where our understanding of health literacy expanded beyond what we once knew. All right, let's break this down. Imagine a bunch of experts sitting together discussing how we can best understand health literacy for Healthy People 2030. The U.S. Department of Health and Human Services, the HHS, formed a team called the Definitions Committee to do just that. Now, this team had an important task: to evaluate the suggestions made by Secretary's Advisory Committee. What they wanted was a fresh way to see health literacy, one that takes into account both individual skills and the bigger picture of our healthcare world. Because remember, the health literacy definition from Healthy People 2010 and Healthy People 2020 focused a lot on the individual. So now our experts had three options to consider. Option one was to stick with the way we had been defining health literacy for 2 decades, focusing on individuals. Option two was to embrace this new idea of seeing health literacy as a bigger system that involves not just us, but also the information and services around us. And then option three was combining the best parts of these two other options and see a whole new way of looking at health literacy. But this wasn't just a bunch of thoughts floating around. Our experts went on a journey to gather opinions from different people. They spoke to groups who knew a lot about health, like Healthy People Topic Area Work Groups and the HHS Health Literacy Work Group. They wanted to know what these groups thought about the old way of defining health literacy, the new way, and if there were other cool ideas out there. Imagine this journey like a puzzle hunt, right? They also opened up a way for anyone in the country to share their thoughts. They put out a notice, kind of like an invitation, asking for people's opinions. And whoa, did they respond. Between June 4th and August 5th, 2019, they got 187 comments, 187 pieces of the puzzle. These comments were like different colors in the puzzle. Some said they liked the new way of thinking, while others liked the old way. And many said, hey, why not combine the two? Here's the magic part. All these opinions echoed what we've been learning over the past 2 decades and what we've really been talking about since the beginning of this podcast. See, health literacy isn't just about individuals, and it isn't just about big systems. It's both. It's like a dance between how well we understand health stuff and how clear the information around us is. So, after listening to all of these voices, our experts had a light bulb moment. They decided to create not one, but 2 definitions of health literacy. The definitions show how we, the people, make smart health decisions. The other shines a light on how organizations help us make those smart decisions. So here are the new definitions given by Healthy People 2030, which are the definitions that we now use and the CDC uses. So first, personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Then we have organizational health literacy, which is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So there you have it, the definitions of health literacy that we now use in the present day. But let's dive deeper into these definitions and talk about their benefits over the previous definition of health literacy, which, just to remind you once again, the previous definition was just the degree to which individuals have the capacity to both obtain, process, and understand basic health information and services needed to make appropriate health decisions. First, let's focus on the personal definition of health literacy, which once again is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So what's so special about this new definition? Let's break it down. First, it focuses on the actual use of health information and services. It's not just about understanding the basics. It's about taking the understanding and putting it into action. Imagine having a map to navigate the world of health. Now imagine actually following that map and making informed decisions and actions based on it. Another exciting change is the shift from appropriate decisions to informed decisions and actions. See, it's not enough to make a choice. It's about making a well-informed choice and then acting on it. It's like having the power to turn knowledge into action, whether it's at your healthcare provider's office while surfing the web at home, or even when participating in community initiatives. But there's more. The new definition doesn't stop at personal empowerment, it has a bigger heart. It's not just about you, it's about all of us. The definition adds a twist by saying that your personal health literacy can also contribute to public health. Yep, you heard that right. Your ability to understand health information and services doesn't just benefit you. It can impact your community, your choices, and even your role in shaping health-related policies. And this is a gem that I think can bring about tangible results and is the way that each and every single one of you guys can help improve health literacy in the US. I think this can really be exploited to help communities flourish in the future and improve overall health literacy. But more on that later. Going back to the definition of personal health literacy, think about it. When you grasp the complexities of health-related decisions, it doesn't just affect your own well-being. It ripples outwards, affecting the choices you make for your family, your neighborhood, and even your society. It's like your personal health literacy becomes a superhero cape, allowing you to tackle health challenges not just for yourself, but for everyone around you. And guess what? This new definition doesn't replace the old measures of health literacy. It complements them. It's like building on the foundation we already had and taking it to the next level. It encourages existing health literacy efforts like education standards and adult programs while inspiring all of us to go beyond understanding and venture into action. So here's the takeaway. The new definition of personal health literacy is like a torch lighting up the path to a healthier and more informed future. It's about making sure you don't just hold the key to understanding health, but you also know how to use it to unlock better lives for yourself and those around you. Now, onto the organizational definition of health literacy. Let's talk about how this is an improvement from the previous definition of health literacy. And to start off, remember that organizational health literacy is the degree to which organizations equitably enable individuals to find, understand, and use health information and services to inform health-related decisions and actions for themselves and others. Now, the idea that health literacy is not just an individual's responsibility, but also a collective effort with organizations. Picture this, a world where health information is crystal clear, where the health systems are easy to navigate, and where organizations work together to ensure everyone gets a fair shot at understanding and accessing health-related knowledge. That's the dream that the new definition of organizational health literacy is bringing to life. So what does this definition tell us? Well, it's like shining spotlight on the fact that personal health literacy doesn't exist in a vacuum. It's shaped by the environment around it, the organizations, the system, the institutions. It's like realizing that you're not alone on this health journey. Organizations are right there with you, holding your hand, guiding you toward better health decisions. And here's the exciting part. Organizations have a responsibility to make health literacy equitable. They need to step up and make sure that health information and systems are easy to understand and accessible for everyone, no matter their background or circumstances. It's like a pledge to level the playing field, ensuring that health disparities are eliminated and health equity becomes a reality. But why is this so important? Well, the benefits are remarkable. Studies have shown that when organizations become health literate organizations, magical things happen. Health literacy interventions become like little sparks that ignite positive change. For those with limited health literacy, these interventions prove to be game changers. Imagine simplified healthcare terms and procedures. Suddenly, patients become empowered to take charge of their own health. They embrace preventative services, stick to medication plans, and effectively manage chronic conditions. But that's not all. The power of organizational health literacy extends beyond the walls of a medical facility. It reaches into the heart of public health, where organizations producing health-related information also have to step up. They start communicating clearly, removing cultural barriers, and ensuring that vital information reaches the underserved populations. It's like a symphony of health knowledge, reaching every corner of society. And here's the icing on the cake. The journey toward organizational health literacy isn't a lonely one. Initiatives like the HHS Health Literacy Workgroup, established in 2003, champion the importance of organizational efforts. This workgroup's mission is crystal clear: to make health information understandable and actionable, empowering all health consumers, and to keep the health literacy science vibrant and up to date. So, why expand the health literacy definition to include organizations? Well, I feel like we talked a lot about that already, and you guys probably get the point by now, but it's like the next logical step in the HHS's ongoing quest to enhance health literacy. So why expand the health literacy definition to include organizations? Well, it's like the next logical step in the HHS's ongoing quest to enhance health literacy. After all, health professionals and organizations play a vital role in helping individuals achieve positive health outcomes. It's about realizing that without clear communication, our noble efforts to promote healthy behaviors and recommendations might fall flat. Now, that is all for the definition of health literacy that we now use, and I hope you're able to see how this is an improvement from the previous definition of health literacy. This allows us to set a strong groundwork from which we can create objectives and measures related to health literacy. So let's talk about that now. So what are Healthy People 2030's objectives when it comes to health literacy? And I just want to note that all of their objectives are measurable, which we'll dive into later. But when it comes to the health literacy objective, they're broken down into 3 categories: core objectives, developmental objectives, and research objectives. Core objectives are the tried and true ones, reflecting high priority public health issues and backed by solid evidence. Developmental objectives are the aspirations that are still taking shape, waiting for reliable data to become core objectives. And lastly, the research objectives, well, they're the ambitious dreams, representing issues with high health or economic burdens, and they're waiting for their moment in the spotlight. First up, with the core objectives, we have a mission to increase the proportion of adults who report that their healthcare provider always asks them to describe how they will follow instructions. It's like encouraging a dialogue between patient and providers, making sure that instructions aren't just handed out, but truly understood and embraced. The second core objective focuses on reducing the proportion of adults who report poor patient and provider communication. It's like a call to arms against misunderstandings, frustrations, and disconnects. This objective aims to smooth out the wrinkles in communication, ensuring that listening, explanations, respect, and time are treated with the utmost care. And the third core objective, well, it's all about empowerment. We're working to increase the proportion of adults who report that their healthcare providers always involve them in decisions about their healthcare as much as they want it. It's like ensuring that every voice is heard and every opinion matters in the health journey. Now, let's set sail towards the developmental objectives. Now, these are aspirations that are still taking shape. Picture this: an online medical record that's not a puzzle, but a straightforward story of your health. Our fourth objective aims to increase the proportion of individuals who find their online medical records easy to understand. It's like turning complex data into a simple and reliable tale. And let's not forget about the fifth objective, a beacon of inclusivity. We're on a mission to increase the percentage of limited English proficient adults who report that their doctors or health providers always explain things in a way that are easy to understand. It's like breaking down language barriers and opening doors to health understanding for everyone. But what about the grand picture, the broader landscape? That's where our research objective comes in. We're stepping up to increase the health literacy of the entire population. It's like nurturing a garden of knowledge, planting seeds of understanding, and watching them bloom across communities. So that's all for the Healthy People 2030 health literacy objectives. But now let's talk about how they will actually measure these objectives. And remember that there are the core, developmental, and research objectives. And they only really have data and measurements for the core objectives, since the others are objectives currently in progress. So let's dive into the first measurement that Healthy People 2030 has set its sights on. This measurement shines a light on the vital aspect of healthcare, how well our healthcare provider makes sure we understand their instructions. Picture this. You've just left your doctor's office, and your head is swirling with new information about what to do for your health. But here's the thing. Did your healthcare provider take that extra step to make sure that you really got it? Did they ask you to describe how you will follow their instructions? And remember that I said that every core objective has a direct measurement. So as you guys can see, this is a direct measurement for that first core objective. And in 2017, about 26.6% of adults aged 18 and over reported that their healthcare provider asked them to describe how they will follow instructions. Now, our target, well, we're aiming for that number to rise to 32.2%, but we haven't really been trending that way because a measurement from 2019 shows that the number actually decreased to 25.6%. So why could that be, right? I mean, you all know that patient-provider times are going down because they have so many patients that they have to get to, so the doctor actually has less time with the patient. So that's why that number is so low, right? Like only 25% of doctors are asking patients how they're going to follow instructions. That's crazy. But how do we actually improve those numbers? Well, that's something that we've been trying to figure out and we're going to talk more about later. But now let's talk about the method. Where does this data come from? How do they gather this data? Well, this data comes from the household component of the MEPS. Think of it as a slice of the population pie, gathered from households that participated in the National Health Interview Survey. The data is collected through a self-administered questionnaire where adults in these households share their experiences. Okay, cool. So now on to the second measurement, which is one that zeroes in on the communication between you and your healthcare provider. Now, imagine this scenario. You're sitting in that doctor's office, trying to explain how you're feeling, your concerns, and what's been bothering you. But does your healthcare provider really listen to you? Do they make sure you understand their explanations? Do they respect your thoughts? That's what the second measurement is all about. Making sure you're not just a patient in the room, but an active participant in your healthcare journey. In 2017, around 8.9% of adults aged 18 years or over reported having poor communication with their healthcare providers. But here's the target. We're aiming to improve that to 8%. But here, once again, we've not been trending towards that target. In 2019, a measurement showed that this number is actually at 9 right now, a slight increase from that 8.9. And just like before, we're gathering this data from the household component of the MEPS. It's like taking a snapshot of the households across the nation to get a picture of the healthcare communication across the whole nation. And now it's time to delve into the third and final measurement on this captivating health literacy journey. This one's all about how involved you are in the health decisions that you make with your provider. All right, picture this. You're at the doctor's office again, but this time it's not just about being heard. It's about having a say in your own health decisions. It's about being a partner in your care journey. In 2017, about 52.8% of adults aged 18 years and over reported that their health care provider always involve them in decisions about their health care as much as they wanted. But hold on, because we're actually aiming to amp that up to 62.7%, almost a 10% increase. But here we've actually been trending in the right direction, because in 2019, the measurement was of 57.2%, an increase of almost 5% from 2017. And where are we getting this fantastic data from? Well, this one's coming from HINTS survey, a cross-sectional survey of American adults. This survey gives us insight into how folks like you interact with health information and care providers. So that is all for the measurements of health literacy used by Healthy People 2030. And now I want to discuss with you guys the outcome of poor health literacy. Why is this problem that we've been talking about? Why should we even bother about it in the first place? And is there any data to back it up? Well, that's what we're going to talk about now. And when it comes to all of these outcomes of poor health literacy, there are 11 of them that I came up with and was able to back up with some data. And I'm going to present these to you in no particular order, but keep in mind that these are just 11 that I came up with and was able to see some data to back it up. But remember that there are definitely more, and you guys should go ahead and do your own research and try to come up with more outcomes of poor health literacy, because there are definitely hundreds of things that you can name here. But here we go, the 11 that I came up with. 1. Misunderstanding health information. Individuals with poor health literacy often struggle to comprehend health information provided by healthcare professionals, medication labels, and educational materials. This can lead to misunderstanding treatment instructions, medication dosages, and potential side effects. According to the American Medical Association, the AMA, nearly half of American adults struggle to understand and use health information. A study by the National Assessment of Adult Literacy confirmed that around 46% of U.S. adults have difficulty understanding basic health information. 2. Medication errors. Poor health literacy can result in incorrect use of medications. Patients may take wrong dosage, miss doses, or fail to adhere to prescribed regimens, leading to treatment failures, worsened health conditions, and increased hospitalizations. I'm sure you've probably heard from your healthcare provider that if you're prescribed an antibiotic and you stop taking it halfway through, it could lead to, first of all, antibiotic resistance, but it could also lead to your symptoms coming back and you having the same condition once again. In a study published by the Journal of General Internal Medicine, patients with low health literacy were more likely to have difficulty reading prescription labels and were at a higher risk of medication errors. A study in the Department of Education showed that individuals with low health literacy are up to 3 times more likely to misunderstand prescription labels. 3. Delayed or missed medical care. Difficulty understanding health information may lead to delays in seeking medical care or preventative services. Routine checkups, screenings, and vaccinations may be missed, allowing preventable conditions to worsen. Adults with limited health literacy are more likely to delay seeking medical care and use preventative services less frequently. 4. Inadequate chronic disease management. Managing chronic conditions such as diabetes, hypertension, or asthma requires ongoing self-care. Poor health literacy can hinder the ability to monitor symptoms, adhere to treatment plans, and make necessary lifestyle changes. Patients with low health literacy are at a disadvantage in managing chronic conditions, leading to poorer outcomes and higher healthcare utilization. Increased healthcare costs. Misunderstandings about health insurance, medical bills, and coverage can result in unexpected expenses and financial stress. Patients may avoid seeking care to save money, leading to more serious health issues in the long run. Limited health literacy is associated with higher healthcare costs due to increased hospitalizations, emergency room visits, and inappropriate use of healthcare services. According to a paper published by the George Washington University, limited health literacy costs the healthcare system up to $238 billion annually. 6. Lower adherence to medical recommendations. This is pretty similar to what I said before, but patients with poor health literacy may struggle to follow medical advice, leading to suboptimal outcomes. This includes not only medicational adherence, but also lifestyle changes like diet modifications and exercise routines. Patients with low health literacy are less likely to adhere to medication regimens, leading to poor health outcomes, but they're also less likely to adhere to diet and exercise regimens. 7. Health disparities. Poor health literacy is often associated with health disparities, as marginalized and vulnerable populations may face greater challenges in accessing and understanding health information. This can contribute to existing inequalities in health outcomes. Health disparities are closely linked to health literacy levels, with vulnerable and marginalized populations facing greater challenges in accessing and understanding health information. Limited health literacy disproportionately affects minority groups and contributes to health disparities. 8. Miscommunication with healthcare providers. Difficulty communicating with healthcare providers can lead to misunderstandings, misdiagnosis, and inappropriate treatments. Patients may be unable to ask relevant questions or express their concerns effectively. Poor health literacy can lead to miscommunication and misunderstanding between patients and healthcare providers. Patients with low health literacy are more likely to have difficulty understanding and communicating with their healthcare providers. 9. Increased hospitalizations. Poor health literacy is linked to higher rates of hospitalization, especially for conditions that could have been prevented or managed with timely and appropriate care. Adults with low health literacy have higher rates of hospitalization and longer hospital stays. An article published by the American Public Health Association showed that people with inadequate literacy had a 52% higher risk of being admitted into a hospital compared to people with adequate literacy, even after adjustment for age, socioeconomic markers, and self-reported health. 10. Lower overall health status. Individuals with poor health literacy tend to have worse overall health outcomes, lower health-related quality of life, and the reduced ability to advocate for their own health needs. Limited health literacy is associated with lower health-related quality of life and overall poorer health outcomes. A study published in the BMJ, a peer-reviewed medical journal, showed that low and medium health literacy were associated with a 75% and a 24% increased risk of mortality, respectively, compared with high health literacy after adjusting for age and sex. 11. Impact on public health. At a broader level, poor health literacy can strain health systems, increase healthcare costs, and hinder public health efforts to prevent and manage diseases. This is a big topic that I thought of and really wanted to include in this list, but is one that I couldn't really find like an exact definition for, and I also couldn't really find data for it, but I think that's something that's definitely going to happen and has been happening as a result of poor health literacy. So these are all the 11 outcomes of poor health literacy that I thought of and encountered. I'm sure that there are many more, so try to brainstorm and think for yourself. What would the consequence be if I couldn't make informed decisions about my health? What would these consequences be for myself, and what would the consequences be for the whole healthcare system? And now on to the solutions. We talked about why this is a problem, we defined health literacy, but now let's talk about solutions. How do we fix these problems, and how do we improve health literacy in the U.S.? Well, a direct plan called the National Action Plan to Improve Health Literacy was put in place after Healthy People 2010. In 1999, the U.S. Surgeon General's report, Healthy People 2010, highlighted health literacy as a critical factor in achieving the objectives of the Healthy People Initiative, which sets national health goals and objectives for a decade, which we talked about earlier. The report emphasized the need to address health literacy to empower individuals to make informed decisions about their health and access healthcare services effectively. In 2000, the U.S. Department of Health and Human Services created the Office of Disease Prevention and Health Promotion, which took the lead in developing and implementing the National Action Plan to improve health literacy. In 2004, they convened a group of experts from various disciplines, aptly named the National Work Group, to develop a blueprint for action on health literacy. Their mission: to craft a comprehensive plan that could tackle the challenges posed by limited health literacy. Fast forward to the year 2010, and voila, the National Action Plan to improve health literacy was born. This strategic blueprint was a game changer, designed to empower individuals and communities by enhancing health communication and promoting clear, accessible health information. But it wasn't just about the individuals. It emphasized the shared responsibility about healthcare providers, institutions, and policymakers and educators. Now, let's dive into the heart of the plan, the 7 overarching goals of this plan that set the stage for change. Goal number 1, to develop and disseminate health and safety information. This goal zoomed in on creating accurate, plain language health information that anyone could understand. Goal 2, to promote changes in the healthcare system. Here, the plan aimed to transform healthcare systems, making them more responsive to individuals with varying levels of health literacy. Goal 3, to equip people with skills to be health literate. This goal was all about empowering individuals to navigate the complexities of healthcare confidently. Goal 4, to create a supportive environment. Communities, families, and organizations joined forces to foster an environment that champions health literacy. Goal 5, to strengthen collaboration. Cross-sector collaboration became the buzzword, uniting stakeholders to propel health literacy initiatives forward. Goal 6, to increase basic research and the development of effective practices. Here, the plan underscored the significance of continuous research and evaluation to refine health literacy interventions. Goal 7, to promote integrating health literacy into education and training. This goal was focused on infusing health literacy principles into education and professional development programs. But of course, a plan is only as good as its outcomes. The National Action Plan sparked a ripple effect. It led to innovative programs, resources, and interventions that empower individuals to navigate the intricate maze of health information. By fostering a society where health information is not just accessible, but understandable and actionable for all, it aimed to bridge the gap in health disparities and improve overall well-being. So you might be wondering yourself, how did they take this grand plan and turn it into practical, impactful change? Well, it all started with a robust strategy to engage various sectors, from healthcare providers and policymakers to educators and community organizations. Let's break it down further by exploring some of the key areas where the plan's influence was deeply felt. 1. Health communication. The plan spurred a wave of initiatives to make health information more accessible and understandable. Organizations across the nation rolled up their sleeves to create materials using plain language, engaging visuals, and culturally relevant messaging. This shift in communication style aimed to break down barriers and empower individuals to take control of their health. 2. Education and training. The National Action Plan's call to integrate health literacy into education and training programs didn't fall on deaf ears. Institutions and educators began infusing health literacy principles into curriculums, empowering students and professionals to communicate effectively with diverse populations. 3. Healthcare system transformations. One of the plan's ambitious goals was to reshape the healthcare system to better serve individuals with varying health literacy levels. This led to the implementation of patient-centered care models, where healthcare providers actively engage patients in decision-making, ensure clear communication, and offer support every step of the way. 4. Community engagement. Communities rallied together to create health literacy initiatives that addressed local needs. Workshops, events, and outreach programs aim to empower individuals to make informed health choices and navigate the complexities of the healthcare landscape. But perhaps one of the most remarkable outcomes was the emergence of innovative tools and resources that put the power of health literacy directly into the hands of individuals. Online platforms, interactive websites, and mobile apps sprouted up, offering reliable health information that's easy to understand. These resources became lifelines, connecting people to the knowledge they need to make informed health decisions. Now, let's touch on the impact. The application of the National Action Plan began to pave the way for a more health-literate society. Patients felt more empowered during their healthcare journeys, healthcare providers became more effective communicators, and health disparities began to shrink as access to clear information improved. As the years went by, the ripple effect of the National Action Plan continued to grow. The commitment to health literacy became ingrained in the fabric of healthcare, education, and public health initiatives across the nation. The plan's influence wasn't just a temporary trend, it became an integral part of the way individuals, communities, and institutions approached health and wellness. And there you have it, an inside look into how the United States turned the National Action Plan into a catalyst for change. It's a story of dedication, collaboration, and belief that health literacy is a cornerstone for a healthier and more equitable future. But what does this all really mean to you? That's what I want to talk about now. How can you make a difference in health literacy and help those around you? Because we want to turn everything that we just learned into tangible actions that we can all take. So let's jump right into it. These are some of my thoughts about how you can improve your own health literacy and at the same time help all of those around you. 1. Be an active health seeker. Don't be afraid to ask questions when you visit a healthcare provider. Understand your health conditions, treatments, and medications. Research reputable sources, and when in doubt, seek a second opinion. For example, when your doctor recommends that you take a new medication, ask why. Try to understand what this medication actually does and what its side effect profile is so that you can truly know if it's the best option for you. Taking charge of your health journey is the first step towards better health literacy. You don't need to know everything, but you have to be open to learning about what's relevant to you. No one's ever going to know the mechanism of action of every single drug that exists in the world, but you can do your best to learn about those that are relevant to you and encourage those around you to do the same thing, which brings me to my next point. 2. Share your knowledge. Spread the word about health literacy. Talk to your family, friends, and colleagues about the importance of understanding health information. Share reliable resources and encourage open conversations about health topics. If you're open to them about your healthcare journey and how you navigate your own health conditions, medications, nutrition, or doctor appointments, it will also encourage them to do the same. You and all of those around you should be an active consumer of healthcare, not a passive listener, and together you can create a ripple effect of informed decision-making. And my next point is related to sharing knowledge. 3. Embrace plain language. If you're going to be sharing health information, whether online or in person, aim for clarity and simplicity. Use plain language, avoid jargon, and break down any complex terms that you may use. This simple shift can make a world of difference in helping others understand and act upon the important health information that you gave them. I know it sounds cool and all to use these fancy medical terms. At least I thought I was super cool when I was using all these new medical terms that I learned. But when talking to others, you really want the conversation to feel personal to them. You don't want to just be showing off your new medical knowledge, so keep it simple and focus on what they should take away from that conversation. And what's so beautiful about everything that I just mentioned is that it makes us more comfortable taking leadership over our health and not just being passive and accepting what the doctor says. It makes talking about health easier, and so people are going to think more about their health, research more about it, leading to more informed decisions in the future. But there are more things that I think everyone should do once in a while to help them in their communities. And a big one here is going to be to volunteer and engage. So I think that everyone should once in a while participate in community health events, workshops, and programs. Volunteer at a local clinic sometime. Volunteer at a school or a community center to support health literacy initiatives. By giving your time, you're helping others gain the knowledge and skills they need to make informed health decisions. But you're also helping yourself here. You're going to learn a ton about these communities and what really matters for them in terms of their own health. And in turn, this will all make you better at communicating. You will become better at talking to people about what truly matters to them, and you learn how to better phrase all of the new healthcare knowledge you learn. And you might be asking yourself, well, where is all this health information going to come from? Like, how do I learn this stuff? Well, I'm going to be honest with you. Learning from your doctor is becoming harder and harder because they just don't have that much time to go into all that much detail. What has worked for me the best is to literally just Google, read books, and watch YouTube videos. If your doctor diagnoses you with a new condition, let's say high blood pressure, go online afterwards and do some research into it. Watch YouTube videos and educate yourself on what you may have so that when the doctor suggests a type of medication for your high blood pressure, you understand which type of medication he's suggesting, and you know if there's a different type of medication that might work better for you. But please, 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 don't fall prey to all the health scares you might see on Google. I feel like if I search up that I have pain in my leg, it's probably going to spit out that I'm pregnant or something. So just make sure that you're using reliable sources. And when it comes to books, there's one book called Outlive by Dr. Peter Attia that is phenomenal. It focuses on preventative care medicine and talks about everything that is pertinent to you living a long and healthy life. Dr. Attia does a wonderful job explaining the aspects of health that are relevant to everyone, from the fundamentals of sleep, exercise, and nutrition, to discussing more specific but extremely important health metrics such as blood pressure and cholesterol. Dr. Attia backs everything with hard evidence and gives tangible takeaways. If you get a chance, I definitely recommend reading that book. And this brings us to the end of this episode. There you have it, our journey through the world of health literacy in the US. We've explored the depths of this critical concept, from its elusive yet impactful nature to its evolution over the years. Before we wrap up, let's take a quick moment to reflect on everything that we talked about and the key takeaways that can truly empower us to make a change. We started by demystifying the term health literacy. It's not just about understanding medical jargon. It's about having the capacity to obtain, process, and utilize health information to make informed decisions and take meaningful actions. And remember, health literacy isn't confined to individuals alone. It also encompasses organizations and systems that play a crucial role in shaping how health information is communicated and accessed. In Healthy People 2030, two dimensions of health literacy take center stage: personal and organizational. Personal health literacy is about each individual's ability to understand and navigate health information for their own well-being. Organizational health literacy, on the other hand, calls on institutions to create equitable, clear, and accessible health information and services that cater to diverse populations. But why is improving health literacy so important? Well, it's a game changer. Poor health literacy isn't just a challenge, it's a barrier that can lead to adverse health outcomes, disparities, and missed opportunities for better health. We explored how low health literacy is linked to reduced health knowledge, medication errors, unnecessary hospitalizations, and overall diminished quality of life. It even increases overall mortality. It's a challenge that we cannot afford to ignore. So what can you do to be a part of the solution? You, yes, you. You have the power to make a meaningful impact. From being an active health seeker and embracing plain language to sharing reliable sources online and supporting health literacy organizations, your actions can create a ripple effect of knowledge and empowerment. By fostering clear communication, understanding, and accessibility, you're helping build a healthier and more informed society. Lastly, I would like to acknowledge an article, which much of its information actually made it into this episode, because it really helped me get a better grasp of health literacy. The article is called Updating Health Literacy for Healthy People 2030, Defining Its Importance for a New Decade in Public Health. It was written by Stephanie Santana and others and was published in the Journal of Public Health Management and Practice. I hope you enjoyed this month's episode and take some time to learn more about your health and share what you learned with those around you. Next month, we'll begin a series about healthcare economics. My plan is to have the first episode giving a general overview of economics in our healthcare system, such as what the main sectors of the market are and how much money goes into each of them. And after that, I plan on making more specific episodes talking about a single healthcare economic topic, such as mergers and acquisitions. Until then, have a good one and stay healthy. Thank you for tuning in to this episode of the Gustavo Franco podcast. We hope our exploration of the world of healthcare has been insightful and thought-provoking for you. Remember, the opinions expressed here are ours and of our guests and should not be considered professional advice. This podcast is a collaborative learning experience for both the producers and listeners. While we strive to convey accurate and up-to-date information, we acknowledge that our research may have limitations. We encourage all of our listeners to supplement their knowledge by conducting their own research. If you enjoyed this episode and want to stay up to date on our future releases, make sure to subscribe or follow us on your preferred podcast platform and social media. We highly value your feedback, so please don't hesitate to reach out with your thoughts, questions, or suggestions for future topics. Thank you for joining us on this healthcare exploration. Together, we can foster a more educated America and contribute to a more effective healthcare future. Until next time, take care and stay informed.